Well, you may have heard about the problems that can happen with your gut, your stomach, gut health. It's not just a gut, it can cause many other health problems. We're going to talk today to Dr. Kulreet Chaudhary, who has been talking about Ayurvedic medicine for a long time. And that's a word that you may have heard and don't know too much about it, but it's an ancient practice. She is also the author of The Prime about depression and other things. Dr. Chaudhary, good to have you with us today on the program.
Thanks so much, Bob.
Yeah, gut health is very more important than people think, isn't it?
It's way more important. And, that's a lot for a neurologist to say because my training was like, hey, the brain is primary. That's the most important organ in the body. And when I began practicing Ayurvedic medicine in addition to general neurology, I had to really switch my belief and realize that, hey, the gut is as important. And actually, the brain and the gut function as one whole unit. And that communication is critical to understand for overall health.
Give us a little brief history of Ayurvedic in case people are not familiar with it.
Sure. So I'll tell a summarize the 5,000-year history of Ayurveda.
Yeah, very good.
Okay.
Do it in 30
Yeah.
seconds, right?
In 30 seconds, you got it, Bob.
Right.
Ayurveda is one of the oldest medical systems on the planet, and it's really simple. Two fundamental beliefs or principles in Ayurveda. One, that food is medicine, and that your food is a principal part of staying healthy. And the other really is just that your habits determine your health, that it's not like you're born destined to a certain disease, but that your habits actually shape what kind of a life you're living. And honestly, modern medicine is starting to come to the same conclusion.
Yeah, it's good because a lot of time doctors aren't trained in that, are they? In medical school, they have to pick it up on their
No,
own, don't they?
absolutely. And, so many of us, we don't even volunteer to start learning these holistic systems. It's usually because we get sick, which
Right.
was my case. I was a neurologist that developed severe migraine headaches, and that's why I had to look back at Ayurvedic medicines because I couldn't figure out how to treat my headaches, even as a neurologist.
Wow. Yeah, so it's good you came to the practice, which is great. Tell us now about gut health. You mentioned food. Is that the only thing people have to worry about? Are there other things they need to do, or what?
The gut is a complex system, and there's a relay between the brain and the gut. And, if you're struggling with mood disorders, part of the answer lays in getting the gut healthier. And if you're dealing with digestive issues, part of the answer is dependent on, your mental health. And so there's several things that I recommend to address the system as a whole. So there's herbs like ashwagandha and brahmi, and those really address brain health and overall stress. A lot of people have heard of ashwagandha. It's one of the most commonly used adaptogens, but it's been used in Ayurveda for thousands and thousands of years to reduce the stress response. Now, brahmi, you may not have heard of, and brahmi is an ancient herb that we use in Ayurveda for peak performance of the brain. And so I always recommend these two herbs, whether you're dealing with an issue in brain health or an issue with the gut. Now, on the gut side of it, there's a wonderful herb called trifla. It's made out of 3 berries, and this is one of my absolute go-to herbs because it helps to heal the mucosa in the gut and helps to support a healthy microbiome. So those are 3 herbs that I recommend for almost all of my patients. But there are some secrets in your kitchen that I want to tell people about too that can help with both gut and brain health.
Great. Oh, before you do that, are these all in tablet form, or do you have to take them raw, or how does that work?
I'm so glad you asked. No, there's lots of forms for this, and so you can take them in tablets and tincture forms. There are the raw powder forms, but I realize that for a lot of people it's hard to mix the powders together, and so they're readily available now. So if you can swallow a pill, you can begin improving both your gut and brain.
Ah, good to know. Okay, now tell us about the kitchen things.
All right. So many people don't realize that what's hidden in your pantry is actually a treasure chest. It's a pharmacy. It's nature's pharmacy. So there's 3 seeds that I love telling people about because they make a potent tea. And in my book, The Prime, I call it the Prime Tea, but it's an ancient recipe. And they're cumin seeds, coriander seeds, and fennel seeds. Now, a lot of people who like to cook Asian foods or like to cook Latin food, they already have these in their pantry. If not, super easy to get, even on Amazon. And you just take a half a teaspoon of each of the seeds, boil it in about 4 to 5 cups of water for about 5 to 10 minutes, take the seeds out, and you drink that tea all day long, and that will nourish your gut. And when your gut is nourished and it's cleared of all that junk that accumulates there, your brain is clearer and your whole body feels more energized.
Yeah, and so so you drink it all day, and people are going to say, "Well, how much do I need to drink? How many cups?" Do you have to break it down that much, or can it be just general type things?
So what I do, and so you'll make about 4 to 5 cups, and you don't need more than that. So what I do, even right now, sitting on my desk, is a cup of that tea. So I keep the thermos on my desk, and I just sip it, and it's just little sips all throughout the day. And the reason why you want to do it all throughout the day is there's different channels that kind of open up in your body throughout the day, and so this tea helps to clear all of those out.
Oh, very good. Yeah, and then stop at night, I guess, in the early
Yeah,
evening.
you stop
Yeah.
stop like about 2 hours. You don't want to be drinking anything 2 hours before bedtime because you're going
That's
to be
right.
eating at night. So I never recommend doing any of that unless you want to get up at 2 a.m.
Right.
And use the bathroom. But yeah, just stop until, 2 hours before you go to sleep. And like I said, it's just teeny tiny little sips. And, oftentimes it's these little things that we do on a regular basis, taking supplements that support our brain and support our gut and making teas like this that help to just boost our digestive function. That it's these little things that we do that can have a really big difference.
And what about when you get to that point? You say you're drinking, which is very easy to do. Certainly, you can spread it out, and that's all part of that. So it's very important. What about alcohol? Should you not drink alcohol at all?
So you're raising a really great question. So most of my answers to questions like this is always, it depends. And the reason why that is because Ayurveda is a highly individualized form of medicine. So it depends on your body type, which in Ayurveda we call your dosha. And if you go to my website, we have the ability to do a dosha quiz so that you can figure out your dosha. But certain body types can tolerate alcohol more than others. For example, if people are heavier built, they are kind of a stocky frame, and they tend to be pretty even, they tolerate alcohol more so than, somebody who is a medium frame, might have like sensitivity to the sun or has a tendency towards rashes or gastritis. That type of body type already has a lot of heat. And, in Native American culture, they used to call alcohol fire water, and it's because it increases the fire in your body, increases the heat in your body. So it just depends on your tolerance. But as a general rule, I never recommend doing alcohol too often and in large quantities for anybody because then it can disturb the gut mucosa. It can start to disturb the microbiome. So the question is, the answer to the question is really, what's your body type and how much of it are you taking? We try to match it up so it's the right fit for you.
Well, very good. Well, Dr. Chaudhary, thanks for talking to us. I want to give you your website, too, that we made reference to. It's Dr. K. Chaudhary, and that's spelled CHAUDHARY, drkchaudhary.com for more information. Thanks for talking to us. Good stuff today. And thanks.
Yeah, it was my pleasure.
All right. Thanks. Bye-bye now.
You have a great day. Bye-bye.